1. In designing a training module for overseas pharmacists, which approach best aligns with adult learning principles? A. Delivering lengthy lectures with minimal interaction. B. Using problem-based case studies reflecting real pharmacy practice. C. Providing rote memorization of pharmaceutical terminologies. D. Encouraging learners to copy standard operating procedures verbatim. 2. When assessing the clinical decision-making skills of overseas pharmacists, which evaluation method is most effective? A. Multiple choice recall tests. E. Open book written assignments. C. Objective structured clinical examinations, OSCEs. D. Peer-reviewed reflective journals. 3. In curriculum development for competency assessment, the inclusion of formative assessments serves primarily to: A. Replace final summative assessments. B. Provide continuous feedback to support learning. C. Lower the rigor of the testing process. D. Delay the evaluation of core competencies. 4. A pharmacist trainee struggles with understanding local regulatory requirements. Which mentoring strategy best supports learning? A. Assigning independent reading of guidelines only. B. Modeling compliance in real practice scenarios. C. Avoiding complex legal topics until later. D. Allowing the trainee to develop their own interpretation. 5. Which communication technique is most effective for educators addressing overseas pharmacists with diverse cultural backgrounds? A. Using jargon familiar only to local pharmacists. E. Speaking rapidly to cover more content. C. Applying clear, culturally sensitive language and examples. D. Restricting discussion to written instructions only. 6. In competency-based assessments, a rubric is essential because it: A. Replaces the need for examiner training. B. Provides standardized criteria for evaluating performance. C. Limits learners' ability to demonstrate creativity. D. Guarantees identical scores for all participants. 7. During an OSCE station on patient counseling, which adult learning principle should the assessor prioritize? Encouraging learners to reflect on their approach after feedback. E. Limiting interaction to standardized scripts only. C. Penalizing creativity in responses. D. Allowing only memorized responses from trainees. 8. A curriculum developer is tasked with aligning assessment content to regulatory frameworks. The most important consideration is: A. Assessing only knowledge of pharmacology. B. Mapping competencies to legal and ethical requirements. C. Reducing the complexity of questions for overseas candidates. D. Using identical assessments from unrelated healthcare exams. 9. Which evaluation method is most appropriate for testing pharmacists' ability to apply ethical decision-making in practice? A. Multiple choice questions with one correct answer. B. Role-play scenarios involving patient dilemmas. C. Matching terms with definitions. D. True-false quizzes on pharmacy law. 10. Which mentoring technique supports reflective practice in overseas pharmacists? A. Encouraging self-assessment and discussion of clinical decisions. B. Focusing exclusively on the mentor's experiences. C. Assigning repetitive memorization exercises. D. Discouraging questioning during feedback sessions. 11. When assessing communication skills, which method provides the most objective evaluation? A. Peer observation without structured criteria. B. Patient simulation with standardized checklists. C. Written self-reflections only. D. Group discussions without moderation. 12. Which principle of adult learning is demonstrated when overseas pharmacists connect new regulatory knowledge to prior practice experience? A. Readiness to learn. B. Rote memorization. C. Dependency on the instructor. D. Passive knowledge absorption. 13. A key purpose of formative feedback in the assessment of overseas pharmacists is to A. Discourage learners from taking risks. B. Provide timely guidance to improve performance. C. Assign final pass-fail decisions. D. Reduce the number of assessment stations. 14. Which is the most effective strategy for curriculum developers to ensure regulatory compliance in assessment content? A. Reviewing current legislation and professional standards regularly. B. Allowing assessors to create questions without oversight. C. Prioritizing ease of delivery over legal accuracy. D. Using outdated regulatory frameworks for consistency. 15. An overseas pharmacist demonstrates clinical knowledge but struggles to apply it in local practice settings. Which evaluation method identifies this gap best? A. Open-ended essay on drug classifications. B. Simulation-based assessment with contextualized cases. C. True-false quiz on pharmacology facts. D. Multiple-choice recall questions. 16. When mentoring overseas pharmacists, modeling professional behavior is important because A. It replaces the need for written guidance. B. Learners internalize behaviors through observation. C. It minimizes the need for direct communication. D. It reduces the accountability of the mentor. 17. In test item development for competency exams, what ensures fairness for overseas pharmacists? A. Using culturally neutral language and contexts, including only complex, local slang in case studies. C. Limiting questions to domestic drug brands only. D. Avoiding the use of standardized marking rubrics. 18. Which adult learning principle is applied when trainees are encouraged to identify personal learning needs before starting the program? A. Self-directedness. B. Dependence on instructor guidance. C. Passive participation. D. Memorization of content. 19. The most effective way to evaluate a pharmacist's ability to handle medication errors is through A. Role-play or case-based simulation. B. Written recall of error definitions. C. Matching exercises on error types. D. Timed multiple-choice questions. 20. Which communication strategy best supports pharmacists adapting to local healthcare systems? A. Active listening and paraphrasing during patient interactions. B. Relying solely on medical jargon for precision. C. Avoiding patient dialogue to prevent miscommunication. D. Delivering rapid, information-heavy consultations. 21. In curriculum development, aligning learning outcomes with assessments ensures A. Validity of the competency testing process. B. Increased memorization by participants. C. Reduced need for formative activities. D. Complete uniformity of teaching styles. 22. Which evaluation method provides the richest feedback for improving counseling skills? A. Multiple-choice tests on counseling protocols. B. Direct observation with structured checklists. C. Peer-to-peer quizzes. D. Matching counseling topics with definitions. 23. When mentoring, using a questioning technique that challenges overseas pharmacists to justify their decisions supports A. Reflective practice and critical thinking. B. Memorization of local policies only. C. Passive acceptance of information. D. Avoidance of accountability. 24. Which principle ensures that assessments reflect the real practice environment? A. Authenticity in test design. B. Use of abstract theoretical concepts only. C. Minimal contextualization to simplify grading. B. Prioritization of time limits over realism. 25. In adult learning, experiential activities are valuable because they A. Encourage application of theory in realistic contexts. B. Focus only on factual recall. C. Discourage independent thinking. D. Replace all forms of feedback. 26. Which regulatory compliance consideration is most critical in assessment design? A. Ensuring patient safety and adherence to legal frameworks. B. Simplifying questions for international candidates. C. Excluding local pharmacy law from the exam. D. Relying on assessor discretion instead of standards. 27. Which mentoring technique fosters long-term professional growth? A. Collaborative goal setting with the learner. E. Giving prescriptive instructions only. C. Avoiding career discussions during training. D. Limiting support to immediate tasks. 28. Which communication barrier most negatively affects overseas pharmacists during competency assessment? A. Use of culturally biased language in test items. B. Clear instructions with examples. C. Structured role-play activities. D. Standardized rubrics with transparent scoring. 29. In evaluation, reliability refers to A. Consistency of results across multiple assessors and occasions. B. The relevance of test content to practice. C. The fairness of assessment language. D. The timeliness of examiner feedback. 30. When delivering formative feedback, which technique best supports adult learners? A. Providing constructive, actionable suggestions. Delivering only negative points to highlight gaps. C. Avoiding dialogue to save time. D. Using vague generalizations.